Karanja from Kenya. I have Obioma from Nigeria. I have Mpatso from Zambia and Ronnie from Zimbabwe. What I'm going to do is that I'm not going to be introducing the speakers, but I'm going to allow them an opportunity to introduce themselves and speak more about the work that they do within the area where they are from. So I'm going to hand over to Obioma.
Hi, everyone. Thank you, Crystal. And it's good to be on this webinar to discuss this very important topic. So my name is Obioma Chukwuike and my pronouns are they, them. I'm speaking to you from Nigeria. The Executive Director of Intersex Nigeria. And at Intersex Nigeria, we look at programs and initiatives that promote the well-being of intersex people, advocating for their rights, their inclusion and recognition, not just in healthcare, but other social, political, and economic rights that intersex people are always excluded from. So that's the basic thing that we do at Intersex Nigeria, and also collaborative efforts within Nigeria and outside Nigeria on how to globally shift the intersex global movement forward in getting our demand done. Thank you.
Thank you, Obioma, for that introduction. I'm going to move over to James.
Good morning, good evening, depending on where you are. I am obliged to be part of this panel. Thank you to the Iranti organization, because this is one of the very list of the webinars we have had as the intersex community, where we are talking as intersex people. So I am the director of Intersex Person Society of Kenya, which is based in Kenya. We do a lot of issues regarding the intersex community. One is creating community awareness on who intersex people are. We do a lot of advocacy within the legislature, the judiciary, and also the executive. We also do socioeconomic empowerment to the intersex people. This is in terms of education, employment, placements. The other thing that we are urging into is on the well-being of the intersex people in terms of health. Thank you so much, Iranti, for giving us this opportunity to be here.
Thank you so much, James. Mpatso, are you ready for us?
Yes, Crystal, thank you so much. And thank you so much for organizing this, engagement. It's rare that we've got engagements like this, and we greatly appreciate. So my name is Mpatso Sakala, and I am from Zambia. I'm the founder, executive director of Intersex Society Zambia, an intersex-led organization which exists to facilitate recognition, protection, and promote social economics of intersex persons, as well as we aim to transform their lives in terms of their well-being. For us, we want to have intersex persons who are well-informed, motivated, and active individuals, so that can also contribute to the economic growth of the country at large. Our programming and our focus mostly, like I said, is the well-being of intersex persons. So if you look at all sectors and all angles, the well-being of a person. So we are talking about health, we are talking about the social, economic frameworks. We are also talking about issues around religion and issues around traditions. So in short, just to be brief, is that we look at the well-being of intersex persons at different levels. So be it as well in schools, at work, everything think of in terms of having someone have their well-being looked in. And as Intersex Zambia, we've got different ways in which we do that, and outreaches, we have sensitizations, we also have education. The list is endless, but basically we accreditate for the recognition and also just making into the of intersex in Zambia.
Thank you, Mpatso. Ronnie?
Hello, everyone. I hope everyone can hear me loud and clear.
Perfect.
Since we, oh, thank you. I was just a bit worried because we're experiencing a lot of rain, bad weather, power outages, and etc. So yeah, I'm glad that people can hear me. First of all, I would like to thank Iranti for creating this platform to talk about these much important issues, especially the health of intersex persons in Africa. And thank you so much, Crystal and Tim, for also standing up and making sure and ensuring that this program becomes a success. Kudos to you guys, and to all my colleagues, thank you very much. First of all, let me just quickly introduce myself. My name is Ronnie Zuze, and I am from the intersex community of Zimbabwe, ICOS in short. And I hate introducing myself as the director, but I'm the founder of the intersex community of Zimbabwe. Most of our work, we mainly focus especially around intersex people themselves in terms of like self-empowerment. And when we're speaking about self-empowerment, we are starting from issues of themselves being empowered in terms of self-knowledge, self-understanding, self-acceptance. These are very, very key issues, because without that, it will be very, very difficult for us to be able to achieve the things that we want to achieve. And also on top of that, issues around health. They are very key issues that we are dealing with, because we know that intersex people, just like everybody else, they deserve to have affirmative and comprehensive health care. And we are talking about issues of mental health, psychosocial support, peer support, physical health itself. And we also have programs around self-empowerment in terms of economic empowerment. And we also focus and we have a very strong focus on issues of educating and informing, especially starting from our own families, people around us, people who are close to us, because we programs that we do in terms of economic empowerment, whereby we are empowering our community members so that they can be able to sustain themselves in terms of economic empowerment. Because we do have projects whereby we are training, because as much as we know that it's very difficult for most intersex people to be employed in the employment sector. So we make sure that we empower them with skills so that they can be able to fend for themselves and have a meaningful life. And with that being said, I think those are some of the programs that we are running at the moment. Thank you so much.
Hello, thank you so much. Thank you so much, everyone, for your introductions. Our host, Crystal, has just been kicked out of the Zoom call. We're trying to fix that. In the meantime, I think that we just want to take some time as Iranti to thank our guests for joining us. My name is Nolwazi, and I'm the communications manager here at Iranti, and I am running logistics behind the scenes. So I'm just, if you can give us 2 seconds, I'm just trying to reconnect Crystal, because she has been kicked out due to load shedding. And as Africans, we know that power cuts have now become, unfortunately, a part of our lives. So we're going to sort that out now. But basically, we also want to thank everyone who's joined this conversation with us this evening. We really do appreciate your time. We know that it's a Tuesday evening. I think that this conversation is really important for us because we want people to know the kind of harms that intersex people face when they're interacting with the healthcare system, not just in South Africa, but across the continent. And this conversation becomes important because what we're hoping to get to is to begin to think around solutions about how it is that we can begin to resolve the problem with allies and partners to the intersex community on the continent. And that's really what this conversation is about. And so what we're going to do is we're going to have a conversation with the panel and Crystal when she comes back. She's reconnecting. And once Crystal has reconnected, when we're done with the conversation, we're going to open it up for some questions to our panel, if there are things that you're wanting to ask our panel of experts. This is a fire panel. So if you are just joining us, I'm telling you now, if you want to ask any questions around the experience of intersex people on the continent as it relates to healthcare, these are the people to ask. These are the people that are doing the work on the ground. So Crystal is back with us. I'm just going to spotlight her and then we're going to continue with the conversation. Crystal, can you go ahead so long, and I will find you in the meeting things and make sure that you're on with the rest of the panel.
Perfect. Thank you so much, Nowazi. I mean, how fun would things wouldn't be fun without load shedding, eh? Like, we know this happens. Thank you so much for all the panelists for introducing themselves, and also thank you for the amazing work that you are doing in Africa. I'm also really proud that we could come together as Africans, as intersex Africans, to have this conversation. I think before we go ahead, I'm just going to start with something simple. We have a lot of people in this call, and maybe not everybody knows what it is to be intersex, right? And I'll try to do an explanation that's simple, that everybody can understand. So when we talk about intersex, we are saying that intersex is an umbrella term used to describe a wide range of natural bodily variations. And I just want to say the word natural again. This is natural. Intersex people are born with 6 characteristics that do not fit the typical binary notions of male and female. In some cases, intersex traits are visible at birth, while in others, they are not apparent until puberty. And some intersex variations may not be visible at all, right? So this means that anything from your genitalia, your gonads, ovaries, or testes, chromosomes, or reproductive system are not completely aligned with one of the gender assignments. So experts do estimate that about 1.7% of people are born intersex, right? But as intersex activists, we always dispute this 1.7% because we believe that that is only for people that has sexual characteristics that are visible at birth and are therefore registered as intersex. However, there are so many other intersex variations, and we don't feel that this number actually recognizes all the intersex people out there, right? And why we are having this conversation tonight is about the treatment of intersex people, right? As intersex people, doctors normally operate with this concealed method of care. They force you into secrecy and shame, and they don't want you to talk about your intersex body because they make it out to be that you are not normal, or that you have to be fixed as an intersex person. And as intersex people, we really want affirming healthcare for intersex people that also recognizes our intersex bodies, and healthcare that would just allow intersex people to exist without medical intervention, especially when it's unnecessary, and also sometimes unethical practice on intersex people. So I'm going to start with my panel. As Nowazi explained, we'll have a conversation, and if you have any questions, please do keep your questions. If you want to ask it in the chat box, also please go ahead and ask it, and then we'll have a section for questions as well. But yeah, thank you so much again for your patience during that load shedding moment. So I'm going to start with my panel, and I'm going to go to Obioma. And Obioma, I would like to ask you, what do you think is the biggest challenge in healthcare that intersex people are facing?
Thank you, Crystal, for that question. From the experiences and conversations from intersex people, because I won't speak only for myself, but I also speak as a representative of the intersex community, having a lot of engagement with intersex people. One of the biggest challenges that intersex people have is having access to, healthcare providers who actually understand intersex and have the experiences to render services to intersex people. We have a lot of healthcare people in different dynamics of healthcare, but the issue is, do they understand our body? Are they willing to accept our body? Are they willing to accept that intersex people really exist and intersex is another aspect of sex? Are they willing to look into these challenges and issues that intersex people need healthcare services for and give them comprehensive health services? The truth of the matter is that the treatment, there is no friendly relationship with healthcare providers, and they don't even understand. And when you understanding comes with acknowledgement, they have not yet acknowledged as much as they should that over the years that intersex persons have been humanly have been violated in different aspects of healthcare. They have not accepted the different harmful practices that healthcare systems have meted on a lot of intersex persons who have these lived experiences, and these lived experiences have caused a lot of damages and harm to their bodies. So I think the problem is them acknowledging that intersex people actually exist, acknowledging that they don't understand, and they are willing to cooperate and collaborate with intersex persons and are willing to make it a safe space for intersex people to access these services. So I think these are the issues that are the key, challenges that are faced in healthcare system from my, engagement so far with the intersex persons.
Yeah, thank you so much for that, Obioma. And something that really stood out for me is that you said that healthcare providers just do not understand our bodies, right? And sometimes I think, we as intersex people, we live with this identity, we live in this body, and we understand our bodies, but often we are not allowed an opportunity, to express ourselves because the decision gets made for us, right? That's why as intersex activists, we are asking that intersex people has the bodily autonomy that they deserve, because we are not the ones that gets to make the decisions for our bodies, but it's actually doctors that make the decision for us, right? Um, James, in your opinion, what because of this healthcare practices of doctors, what do you think are the common misconceptions people have about intersex people?
Thank you, Crystal. And I think, as my colleague alluded to, I think one of the biggest issues has always been access to healthcare. But we must also understand where is the issue in terms of access to healthcare coming from. And the biggest barrier has always been the language used, and this language has existed between outside the medical fraternity and within the medical practice, that they see you as a disease, and therefore they tend to pathologize you as an intersex person. That anytime you step in, the first thing, they don't see you as a human being, but they see you as a disease that should be treated to conform, within the existing parameters of what the society defines to be the norm, and the norm being male and female. So the other thing that has always been the biggest barrier to access to this healthcare has always been the perception from a cultural point of view, in the sense that when a parent, for example, gives birth to an intersex child, they team up with doctors trying to create this social emergency, and therefore it should be treated. And within that process, when people realize the kind of issues they have gone through, the torture, the idea that you were treated like a guinea pig within the medical fraternity, then you don't see the need to go to the very same people who treated you like, a medical subject, where you go in and there's no right to privacy that every medical student want to see, I want to see who is an intersex individual. How do they look like? Are they human beings? And they want to even touch you. So that idea that you also not very comfortable within the medical environment makes you feel that, or becomes one of the barriers to access to the healthcare for the intersex people.
Yeah, thank you so much, James. And I think you've highlighted something really important, that intersex people are treated as science project. The moment a doctor has an intersex patient, they totally disregard you as a human. They disregard your privacy, they disregard your autonomy, and they put your body up for display, right? And the thing is, what people don't understand, that right now in 2022, this is still happening to intersex people. We have constitutions in place that says we have to respect human dignity, but intersex people's human dignity is not respected, and their bodies continuously get violated through this medical torture, like James said, that intersex bodies get through, right? And just going over to Mpatso, when we're talking about this inhumane treatment that intersex people receive, how do you think we can combat this as the intersex community?
Crystal. To this speaker, I think you've laid a good to tackle issue. Also, that is going to tackle
Mpatso, you're breaking up and we can't hear you clearly.
Can you hear me now?
No, you're still breaking up. So I'm gonna give you a moment and I'm gonna come back to you, if that's okay with you, and then I'll move on to Ronnie. Thank you so much. So Ronnie, just the same question. So when we're thinking about these violations that intersex people are facing through the health sector or the medical sector, how do you think we can combat this as intersex people?
Thank you very much, Crystal, for that question. I think I have always said that it's very important for us to look at this, especially if we are the African intersex community, to start looking at this from our own context here in Africa, because unlike in other developed countries, most African countries are underdeveloped, and also access to healthcare. I think to some of us, it's actually a privilege, whereby if you do not have, maybe if I may say, resources for you to access quality healthcare services, then it actually becomes a very, very big problem. So basically, what we have been witnessing, especially in most African countries, I'll speak for Zimbabwe, is that we have actually been witnessing that Zimbabwe is a country that is actually struggling in terms of like providing quality healthcare, even for the
Ronnie, can you hear us?
general public. Not talk about intersex people themselves. So basically, what money, you cannot access quality healthcare services, which those medical practitioners, most people, they're just like, especially even, I can talk about even doctors, they are just looking at issues of self.
Ronnie? I think we might have lost Ronnie. Yeah, it is raining a bit where Ronnie is in Zimbabwe, so the network is a bit unstable. But we'll get Ronnie back shortly. And yeah, I feel like when we speak to intersex
I,
people, hi Ronnie.
sorry about that. I just had a disconnection.
Okay, we can hear you. You
Is
can continue.
all right. Okay. So basically, what I was saying is that we've been witnessing healthcare providers actually fundraising using intersex people, especially babies, because they know that most people and most donors, they are sympathetic when it comes to um, issues of young children. So basically, we are made baits or maybe guinea pigs, whereby people fundraise and they make money out of us, and then probably they just do one procedure on an intersex person and then leave them to see themselves out. And as much as we know that when it comes to intersex, it doesn't only take one surgery for an intersex person to get in courts fixed or corrected. This then becomes a challenge. So I'm speaking about this because this is an issue for most underdeveloped African countries which are struggling in terms of access to healthcare, even for the general public. So for intersex people, it becomes even worse because one, if we are not made experiments, we are actually being used to fundraise for personal gain. So basically for us as intersex activists or the intersex movement here in Africa, I think that it is very much important for us to come together and speak with one voice, to speak against these medical practices that actually leave most intersex people damaged beyond repair. And at the end of the day, there is no redress. There is no, because once a doctor has performed such surgeries, such harmful surgeries, what happens is that after that procedure, they are celebrated, they are awarded, and then they make money, they go. And there is no redress. Even maybe some years after that, there is no even any form of redress to try and make sure that they are held accountable for the damage that they have caused to intersex persons. So basically what I'm saying is that I think as the African intersex community, we need to speak with one voice against such practices, whereby we need to come together and really form an alliance that actually comes up with ways to hold these doctors accountable, and also to make sure that some form of redress, even though it is not enough, but it needs to happen. I think in that way, we also need to also include our governments in order to educate them on the harms that are caused on intersex. So maybe in that way, it could be a way forward.
Thank you so much, Ronnie. And you've mentioned so many things, and really when we speak about damage beyond repair, because intersex people has been centered around doctors wanting to fix them, right? Normally the only treatment would be what we describe as intersex genital mutilation, and there's really no proof that these surgeries actually improve the lives of intersex people. But what we can only see is that all the negative effects and all the repercussions it has on intersex people. And when we look at as us as a region as Africa, we can say that intersex people really just have no access to firming healthcare. And then when we are addressing, government as our departments of health, we're also not getting the support from them in order to change policies that really protects intersex people. I want to ask Mpatso if they had any engagement with government stakeholders regarding intersex healthcare and really creating affirming healthcare for intersex people. and what the response was. Mpatso?
Hi, coming to your question, as in of Zambia, or as you may be aware, we just changed the government last year in August. So what we've done is start having conversations, because even with the previous government, we had started conversations, but the way the change of government, you will find that policymakers have changed. So we need to start having conversations with other policymakers who are now sitting in parliament. So in the engagement, what has been the response? So we haven't actually when engaging with but we are doing in terms of trying to change, which is inclusive of intersex persons in the health sector, is that site was of Zambia able to write a concept note, which got funded. We were able to management. We call care management protocol for intersex, which doctors can be able guidelines to be able to address sex issues. Plan is that waiting for to be reviewed and validated by then after we should be able to table it with the Ministry of for adoption. Once that happens, expect that they should how intersex persons are managed.
Mpatso? I think we've lost Mpatso again. But yeah, thank you so much for that input, Mpatso. And I just want to turn that same question over to James, right? So we all know what's happening, right? Intersex people are being mutilated and their rights is being violated. And as intersex people, we are trying to engage with our Department of Health and governments to ensure that there are laws and policies to protect intersex people, right? We've seen that in some instances, they could be possible opportunities for engagement, but we also see that government does not recognize intersex people as well, and the mutilation that is what is happening to them. How has the engagement been in Kenya when it comes to government engagement around intersex health?
Thank you so much once again. I think you can hear me well,
Yes.
everybody. So I think Kenya is I don't want to say different because we are parts and parcel of the same continent. But at the end of the day, I appreciate that we are stepping forwards as a country when it comes to intersex rights. But sometimes we tend to forget that there is the state and there is the society. And the society has a lot of tenets that hold it, one being the religion and the other being the culture. And what I mean by that is that even today, as much as we have well elaborated legal frameworks on, for example, the rights of women or the rights of old people, as in African society, we still get back towards our culture to define some of these issues and how we can take some of these laws and try to extrapolate on what they exactly mean within our cultural definitions. So sometimes we end up getting lost between, culture and the states. However, I think for Kenya, it is a bit different because if today you Googled one of the most advanced country on intersex rights, Kenya will be among the top. But in the same sense, there are a lot of issues that we have tried to address, within that timeline. And the first thing has always been about awareness. And this awareness means that, one, we get to the bottom and understanding, because we are a country that has more than 45 tribes. So each tribe, for example, has a meaning of what it means to be intersex people. So some of these culture sees intersex people as curses. Now, once you seen as a curse, then that means there's propensity of committing infanticide to these children. The other community might see you as a bad omen. They might let you live, but every day there's a lot of stigma and discrimination. But you see, for the state comes on board and tries to stabilize these situations by, every individual has a right to live, has a right to sexual gratification, has the right to body autonomy. But for the intersex people, it still becomes a challenge for us because we are trying to explain that, look, I'm not as the same as you, who you're a man. I'm not the same as you as a woman. I'm a bit different. Therefore, I might require some different treatment when it comes to some situation. Other thing, for not forgetting that for the intersex people, that there is already an existing system, but this system is a binary system of male and female. Therefore, you are considered outside the existing framework. And for you to be able to exist within a framework, you have to give up some of your rights to exist as who you are for you to fit in. So for the intersex people within the policy framework, it becomes a bit challenging because no matter how educated these individuals are, you have to take them back down to the roots of telling them, look, first, before you try to define me, I'm a human being. And then after that, then you're trying to show them the need for you to exist within an existing system they have created. So every day for the intersex people still here in Kenya, as much as we could purport, quote unquote, to be progressed, we are still trying to strive to ensure that we're fully included within these everyday new created system. So it's very important. And this system, I mean, for the intersex people, the biggest system and their existence is within the health. And this health does not necessarily mean in terms of surgeries and everything. It is everything, because for us to have a better productive society, they must be healthy. So the intersex people should be part and parcel of that existing healthy society. And we lack that even in Kenyan context. But that is what we are striving to achieve.
Thank you so much for that answer, James. And I think yes, there are many things that intersex people are struggling with, right? Struggling with legal gender recognition, struggling to get the correct documentation that they require. But the problem stems from healthcare, right? Because if intersex people their bodies were not altered, or a gender or a sex was not chosen for them, then intersex people would not be dealing with this problems that they are dealing with, right? So we can see that intersex people doesn't receive any redress for the harm that was done to them, and there's also no repercussions for the healthcare sector that is performing these unconsensual and unnecessary surgeries on intersex people, because there's limited laws in place that protects intersex people. But thank you so much for that. To bring it back to healthcare, right? Obioma, I want to ask you, if you had to speak to the medical field directly, to people that deals with intersex people, what is it that you would want them to know about your intersex body, and how is it that you want them to treat intersex people?
Yeah, that question is very important, because I think that is where the root cause of our inaccessibility starts from, because the medical healthcare providers have sworn an oath to take care of all human beings, irrespective of where they come from or who they are. And that simple rule in their acts is the same thing that they are violating, because they actually don't give intersex people, especially children and adolescents, the right information to how their body is, because some of them don't have it, but some that also have this information have decided not to actually be, I will use the word, truthful about the existence of intersex people, because when you have conversations with some medical practitioners or healthcare providers, some of them who are aware about intersex also are the same people who are saying that, yeah, there might be variations, but they see it as a condition, they see it as an abnormality that they need to address. And they don't also tell the parents, who are also the first key contacts to them, about the rightful information about bodily autonomy and integrity that they should provide to their children. Because sometimes these parents are not informed about what intersex is. Some of them, it comes as a surprise. They've never heard of it before, or they feel like it's an abnormality. But if they come to the healthcare providers and healthcare system, and the healthcare, there's an information database, or there's a provision where the medical practitioners and healthcare providers can actually tell them, say, see, this is a normal situation that can occur, and you don't have to freak out of this situation, because some parents actually freak out, and actually some parents are the ones that actually push for some of these harmful practices on their children, because they feel that they're doing the best so that their child will not be discriminated in the society, not knowing that it's a harmful practice that can actually cause a lifetime and irreversible damage to the bodies of their babies. So if I'm meeting with healthcare providers, I'm going to let them know that, see, in as much as the parents come to you for you to give them information or services to their intersex children, and even for adults who later in their life discover that they're intersex, the ball game is on you to update what you know, because I believe that every professional system has a medium whereby they update themselves with the current situation and what is happening, the current happenings in their environment, which I feel that the medical system has failed to do. Like where I come from here in Nigeria, I don't think there is any system in their curriculum wherever they study about intersex people. I don't know, but I don't think it exists, because these are where it starts. Because if they are intersex studies in their curriculum, whereby the young medical and healthcare providers are able to understand this situation, I understand that this is a natural variations with the body, and they also understand that sex is not binary, because I think that is where the problem even started, saying biology also made us understand that sex is binary, but at the end point, sex is non-binary, and also culture and religion playing a major part in it too, because some of these healthcare providers also, instead of paying attention to their ethics as professionals, they also bring in their personal values and beliefs in what they are doing in their professional field, which is very, very unethical, because you cannot be treating or wanting to provide services as a professional to someone, and you're putting your personal biases into it. Because some of them will look at, for instance, someone that their religion strongly is against anything that has to do outside the binary notion, will tell you, oh, they might not even tell you, they might go ahead and give you false information just because they want to satisfy not their conscience, but their beliefs and their values, which is not what is meant to be in front of the city. Should be making sure that every human being is treated as a human being first, is given the authority to determine what happens to their body, not secondary. That is why we are strongly against intersex genital mutilation, which is still going on in most federal hospitals, not just private hospitals. Most federal hospitals, like in Nigeria here, are the ones championing these surgeries. They are even the ones, publishing it and saying how they have been able to correct intersex people. Last year, there was a state government that actually advocates for a center to be provided where they'll be fishing out intersex children and adolescents to operate them. So these are where you see that there's a lot of work to be done, and the medical health system has to play the big role here, because these are the people that we hope that will give us professional, guide about how our body should, how we can manage some of the issues and challenges that we face as intersex people, and also give appropriate information. Because if they are saying that they are healthcare providers and they can champion the cause, they should be able to understand this thing, collaborate with this community and understand their need, and also help as allies to champion it not just in the medical line, but also on other welfare packages, saying to the government, see, these people need to be heard, these people need to be recognized because they are not totally as the same as the binary notion of sex. So I think it's them coming to terms in agreeing that they have wronged the intersex community in the past, and looking forward to how they will collaborate, because most times they don't want to collaborate, and that's where the problem also lies. They don't want to collaborate with the intersex community. They don't want to understand us as a people and say, okay, how can we be able to provide, good and comprehensive healthcare services to you people. They want to do the research themselves. They want to understand it themselves. But even in other situations where you go to meet a healthcare provider, you're able to tell the healthcare provider, first of all, what is symptoms that you have before they can help you. But in this situation, they are helping us without asking us, and which is totally wrong. So I think it's asking them the right questions and them being able to acknowledge that they have been doing it the wrong way, and if they are ready to channel it in the right way.
Thank you so much, Obioma. And that is so powerful. And one thing that really stood out for me is that we need to depathologize intersex bodies, right? We need to stop seeing intersex people as a disease or as an illness, and we need to let intersex people exist. Exactly what you said. We have proven that sex is not binary and sex is on a spectrum. And everyone needs to realize that boxes are made for things and not for people. We shouldn't have to want to force people into boxes of these binaries, but we should let people exist on the spectrum that they are. And I think it's so important that medical health professionals needs to understand that, yes, they signed an oath to protect people, right? But they also need to understand that they are not the experts on everything. They can't be an expert on something that they probably focused on in one module, but they need to realize that intersex people are the experts because we are living in this intersex body. Thank you so much for that, Obioma. Speaking to what we want to say to the medical field directly, Ronnie, I want to ask you, what do you think intersex people or allies or people that are in support of intersex people, what can they do to make a substantial difference for intersex people?
Once again, thank you very much, Krista. I think first of all, we need to start at looking at even the medical professionals and the rest of the society as people, not as their titles. Because I think that's where the biggest problem comes from. Because right now, whatever the doctor says, it is viewed as if it is right. So I believe that the moment that we start looking at ourselves as human beings first, before we put on our titles, it then becomes it then becomes easy for us to understand, because it starts from the language that that is used even within the medical fraternity itself. Because if something is said it's abnormal, or it needs correction, or it needs to be fixed, simply because it's coming from a doctor, then automatically it is viewed as if it is the right thing because the doctor knows it all. So I think for doctors themselves, if they are listening, I think they need to come down onto the ground and start looking at intersex people as human beings, just the same way as they are. And to stop using pathologizing language that actually gives people an idea that intersex people need some fixing, or they need to be corrected, or they're abnormal, they need to be normalized, because we are normal as we come. We are as normal as we are. So I think if we start by correcting our language, because if take it for example, if a parent brings their child, or if a parent gives birth to a child, and then they say they use such language, obviously the parent is automatically going to opt for surgery. So I think the language that we use to describe intersex people, to describe intersex bodies. It's very important in shaping the way forward as to how are we then going to be treating intersex persons. So I think even as it comes to our policymakers, the reason why intersex persons, we are not even listened to, no matter how much we know ourselves, no matter how much we understand ourselves, is because the doctor said so. So there's nothing that I can tell a policymaker or a doctor or any other person that is viewed as if it is right, despite the fact that I'm the one who's living this reality. So I think the language itself, we need to start by changing the language. We need to start by respecting intersex people and viewing them as human beings. I think if we start by doing that, we can actually lead to somewhere. Thank you.
Thank you so much, Rani, and you really made an important option right now. When we're speaking about parents and intersex people, right, the language that gets used by doctors, it really coerces parents into allowing doctors to operate on their children, because the moment doctors uses language of your child could develop cancer, at that moment the parent is triggered and they're like, please go ahead with the surgery because I don't want my child to have cancer. And for most intersex people, this is the message that gets provided to our parents from healthcare professionals. So I want to ask James, to intersex parents of intersex children out there, right, that's standing there with the decision that they have to make, right? Because unfortunately, parents still can make decisions for children, and that's why we also need laws in place to really protect children so no one can make decisions for them. But speaking to parents of intersex children, what would you tell them, James, regarding their intersex child?
Thank you again, Crystal. I think the most important thing, within this question, the bottom line is one, the issue of consent. But you see, what is consent? I mean, everybody or anybody can consent to anything. But when it comes to intersex people, you cannot just consent because one, it has a life impact on whatever the decision that you take. And therefore, you need a free and a well-informed consent when you're giving to these doctors. So the parent must be first and foremost be well-informed what they are getting into, because I've always said that, you see, we are part and parcel of our parents, but they must also understand that it is for a short duration within our lifespan, given the days that will exist in this world. Therefore, that very short period of time should not be used to make our very important life in future, and therefore they're doing it based on their distress and whatever they would want, to please the society. That being one. Secondly, not leaving out the school of or the medicine or the medical environment, that the way they package their messaging to these parents, as you say, it is very important, because I would never want to take my child to a hospital and the first thing the doctors look at this child is they're telling me this child in 2 years they'll be diagnosed with a cancer. I don't want that. Therefore, the messaging should always speak to the truth. And what I mean by the truth is we must also be very cognizant to the fact that, for example, we live in an African society. If it's a country, probably the most we would have is 5 cities. That means we have the majority of us lives in the rural areas. Does that messaging really resonate to the people who are in the rural areas? And do they really understand that messaging to a point that they will not use that messaging or that message to also coerce some of these children or these teenage children, intersex people, toward these harmful medical procedures? So I see it as a two-way traffic conversation that we must have. But the most important thing is that we need to be able to, as for example, the intersex activists within the African context, know how to package this conversation from the cities to the rural areas within or where our community members are based. And with that, we'll find that at some point we'll harmonize this conversation and be able us to move in one front. So at the end of the day, for me, the most important thing is messaging and consent, which is free and informed to these parents. Therefore, before these parents get into that critical decision-making process, because we know almost, I think, almost all the constitutions within the African continent has always had the best interest of the child. But that is a critical thing or a component thing that we must, interrogate as the intersex community, because it has always been used not for us, but against us and subjecting us to some of these unwanted cosmetic surgeries. So my bottom line is that we need to have parents of the intersex children have, full information on what will happen to their children once they decided to take either route A or route B on the well-being of their children.
Thank you so much, James. And, really consent is very important. And we need to come to the realization that we cannot make decisions for children to alter their body. We need to give that child an opportunity to be of an age where they can decide what they want to do with their body. Also, intersex people do not need to be fixed. Intersex people are perfect as they are, and there needs to be no unnecessary and unconsensual surgeries performed on intersex people as infants, as adults, at whatever journey they are in their life, right? Intersex people needs the facts, and that's what James just said, because the facts are not provided to parents. They make decisions based on what the doctors provide for them, and that takes away the autonomy of intersex people. I want to thank my panelists really for this engaging conversation. And I feel like this is a conversation that can go on and on. But I do think it's really time for us to just look at some of our questions that we have, and we can allow some of our panelists to really engage with the audience and ask some of the questions. I do see we have a question from, let me just get it, from Robin Atson. And the question is, are there actual life-threatening risks to not being medically treated as an intersex person? Obioma?
Okay. So the answer is there is no life-threatening risk to not being medically treated as an intersex person. The only life-threatening risk an intersex person can experience is the same life-threatening risk that any human being can experience in the course of their life, which we see in different cases. Different people that are not intersex have different life-threatening challenges along their life, and that is what an intersex person too can experience as a human being. So there is no life-threatening risk being an intersex person.
Thank you, Obioma. James?
Sorry for that. I think I would take a little bit different way from my colleague Obioma, in the sense that based on your first definition, that intersex is an umbrella term. But what is an umbrella term? It means that there are very different variation and rate that are encompassed in it. And the problem is that I wouldn't want to get into the medical issues of it, because then that's pathologizing. Therefore, we must be very cognizant to the fact that there are more than 46 different variations of intersex people. And for example, take individuals with CAH or congenital adrenal hyperplasia. These are individuals have life-threatening issues, but they fall within the intersex umbrella. And therefore, one of the most important things is that we need to walk journey with the doctors, because our existence, to be very honest, in one way or another, is attached to the existing medical fraternity. But what we want is them to give the human face on the reality and not to overdo their issues in terms of cosmetic surgeries or unwanted surgeries for the existence of the intersex people. So my take is that there are individuals who would really need for their existence, and for us, all of us here, you can check CAH, and it's part of one of the variations within the intersex individuals, and realize that for these children to, or these individuals to be able to exist their normal life, from probably the second or third week, they need hormonal treatment. Therefore, if they are not given that, means that we end up losing them. And to be very honest, there are very few of them who are within us, within the intersex community, because we lost them because the doctors could not diagnose them at that age. So I would believe that one, treatment does not necessarily mean that we are subjecting these individuals to surgeries. However, we need to come into not necessarily an agreement. We need, the most important thing is for the existence of the intersex community in a humanistic way. Therefore, if there is a way that the medical fraternity can be able to help us, have a longer life, we are in for it as the intersex community. But if they are reducing that, we are not in for it. So at some point, there are some issues that need medical attention, but at the same time, there are none that does not need medical attention. So those are some of the two conflicting issues that we must always have with ourselves, because then, as we said, there are more than 47 variations. Your variation might be different with me, and I don't want you to subject me to a variation and the existence of your variation, but I need to exist as a human being, regardless of my variation.
Yeah, thank you so much, James. Right, and I think also coming to this question, are there actual, life-threatening risk? And I think that's not what the conversation. The conversation is that doctors believe that sex is binary, right? They believe there's male and there's female. According to them, the intersex people do not exist. So what they are trying to do, they are trying to force intersex people in those binaries. So they have decided this is what a female should look like, this is what a male should look like. If you look any different from what they think they know, they try to fix you and they try to put you in one of those boxes. And that is where the problem starts for intersex people. It's not about health. It's not about their lives being at risk. It's about binaries. It's about doctors enforcing the binaries, and then intersex people living with lifelong complications due to unnecessary surgery that was performed to them. So if we should just allow intersex people to exist and to just live their lives as intersex people and give them the bodily autonomy that they deserve and give them the self-determination for them to decide what happens to them, we should have a better society, and we shouldn't have intersex people that are struggling. Because the moment we have this unnecessary medical surgeries, it leads to different things for intersex people. I see Patso is back. Patso, what is your take on the question regarding, are there actual life-threatening risks to not being medically treated as an intersex person?
Okay. So first and foremost, to respond to your questions, when I was just joining, I just heard James talking about variations. So like we may know there are different variations, and not all variations need like medical, attention where they will need to have interventions done. But answering the question, yes, they are there. There are variations which may be life-threatening and may need interventions there and then. But I think as intersex persons, this is where we are saying, for as long as the variation is not life-threatening, then no interventions or surgical interventions should be done on the child. So to answer your question, yes, we have some variations which, or we have some situations or intersex variations which may be life-threatening, but it's not always. There are rare cases actually, based on the work I've done. I've seen that there are rare cases, and most of the variations with the people I work with, they don't even need a medical intervention, or they don't present themselves as life-threatening variations.
Yeah, thank you so much, Mpatso. And we also have to say at any birth for any human, right? There can be risk when a child is being born. There could be different risks that a child have. But what doctors need to do is that also they need to concentrate on the thing that's at risk and not concentrate on the child's genitals. They shouldn't concentrate on putting the child in a binary and choosing a sex for them. For if a child doesn't have a urethra opening and they're unable to pee, let's focus on that. Let's not focus on, well, then this might be an intersex girl, so let's cosmetically give them a vagina. So that is what we are saying, is that this is the intervention that we do not need. But if there is health risk and there needs to be surgery because of that health risk, then the doctors should be focusing on that and not on the binaries, because now they're focusing on binaries, and that is creating the problem for intersex people. We have a question, Ronnie. We have a question, and the question is from Shola. I hope I'm saying it correctly. The question is, what are some of the best advocacy interventions to raise awareness at community level, country level, and regional level? Ronnie? We might have lost Ronnie. I'm going to pass that question over to Obioma.
Okay, so the question is, what are some of the advocacy interventions, right? So there are a lot of advocacy interventions that can happen for intersex rights at country and regional level. Some of them include sensitization programs that can help to improve the knowledge of different stakeholders, state and non-state actors, educating them on various issues and challenges, and also coming in terms with them to understand how they can come in to help to actualize some of the demands of the intersex community. There's also media advocacy, which is very, very strong, because a lot of people, if we want to sensitize, they're not just the state actors and non-state actors right now. If we want to sensitize the society at large, people that you might not reach on a daily basis, we can use media. That is why media advocacy, to also paint the right narrative about intersex people, because the media has a big, they have huge influence on the society, because different types of media, whether mainstream media or social media or any type of media, they have different influence on society and what information that goes out there. So I think it's also another platform of advocacy that can be leveraged on to engage people and also get feedbacks and also see how to promote the intersex visibility and rights. Then also we can talk about community engagement. Now, when you're talking about outreaches are where you can actually have one-on-one interactions with different stakeholders, whether religious leaders, traditional leaders, and even youths or parents, like a town hall meeting or something that can actually bring people together to talk about these issues and why it's important to create policies or laws that can actually help to advance the right of intersex people. So, There are also what they call, we can actually also use a research. Research is something that is also good for advocacy, because research is what brings out some of these key challenges and needs, and also kind of data collection, which is very important, because data is what proves that these things that we're actually saying are actually happening. Because most times when I'll go out to tell people that see what is happening and what is happening, they always want proof. And when we have research-based, different research-based priorities that are addressing some of these gaps of data, to let not just the society now, but stakeholders, agencies, and even allies who also want to join hands also in promoting the visibility and rights of intersex people and well-being, and also collaborations with allies, whether international bodies, whether private organizations, and other civil society organizations who are also like the LGBTI, the child rights, disability rights, the feminist groups, people that have the same values and principles that guides us to, coming together with them and also raising our voices with their platforms to be able to address some of these issues. I think these are some of the advocacy interventions that can happen at both country and regional level.
Thank you so much, Mpatso, for that wonderful answer. And I hope intersex activists or allies that's on this call really took note of what Obioma said. It's really amazing. Mpatso, I know that you are a part of AIM, which is the African intersex movement that works regionally. So can you tell me a bit more of the interventions that AIM is doing to really promote the rights of intersex people?
Thank you, Crystal. Thank you so much. So the African intersex movement, maybe to start with, is consisting of different intersex-led organizations from different countries. So how M works, I think it would be very important so that we first understand how M is working, to also be able to raise awareness and also contribute to the well-being of intersex persons in the region. So AIM is made up of different intersex-led organizations from different countries across Africa. So whatever works are being done in different countries feed into what AIM does. So AIM as a body exists so that it can be able to bring together different intersex-led organizations to have a unified voice, as well as also be an entity that is able to also assist intersex persons be able to fundraise, at the same time look into the issues of capacity building for intersex-led organizations. Quite all right, AIM is still a very young movement, and also there's still a lot which needs to be done, but work has already started, happening. Whatever different intersex-led organizations are doing across Africa feeds into what AIM does. So some of the interventions we are looking at, so based on what I've presented and also what AIM's focus is, so it's capacity strengthening for intersex-led organizations, and also being an entity where intersex persons can come together and have a unified voice in terms of doing our advocacy. We talked about how do we shape our narrative, because imagine if Kenya is telling a different story, Zambia is telling a different story, we'll be seen like, having conflicting ideas on how we want to move as the intersex movement. So it brings us together so that we can have a unified voice and also be able to come up with strategies which can better address intersex issues holistically across Africa. It also serves as a platform where intersex-led organizations as well as intersex activists can also exchange knowledge, because different organizations, different activists have got different experiences, which each and every one of us can learn from. So it's an exchange, it's a platform where people can exchange. If we look at how intersex organizing has been in Africa, even across the world, You can see that as intersex led organization and activists doing this work, we don't have funding. Actually, we operate on little to no funding. So you find that we look at other avenues in terms of if we don't have this funding, then how do we still make our work move? We rely on our lived experiences and knowledges as intersex persons. So you find that AIM also serves as that institution which wants to also be able to mobilize funds for intersex persons to also do their work. So that is just in a brief, that is what AIM serves to do. Also, when one of my colleagues was also presenting, we also looked at issues of tokenism is real, whether we like it or not. So you find that we want to create that institution where there is credibility in terms of being able to say this is intersex work being done by intersex people. We don't want a situation where we have spaces where there are no intersex people to be able to present their own issues and be able to shape their own narratives. Many are times when we are asked to say, is this intersex-led organization really an intersex-led organization? AIM will be there to serve as a reference point for different intersex-led organizations. So in a nutshell, so just some of the work we've done as AIM, we've been able to mobilize some funds, which we had supported some intersex organizations, just some core support to be able to do their work, of which we are glad to hear that some of them with that money, they were able to register their organizations. At the same time, as AIM, we are also able to mobilize some funds to be able to put in place policies which can guide how AIM is going to conduct its business, and also to have a roadmap on how we want to do the work as AIM. So as we are speaking, AIM has been able to develop a strategic plan. So that is a guiding document on how we want to do our work as AIM. Secondly, we've been able to develop a document which can also govern the operations of the steering committee, because we cannot just operate, like an ad hoc kind of a committee or a leading a team of people to spearhead the work of AIM. In the background, there are a lot of works which are being done, but in a nutshell, those are just some of the things we've been able to do as AIM. And we've also been able to partner with others to be able to present our issues at the African Commission, of which my colleagues even on the call, some of them were part of that engagement. We talked about, Obioma talked about the issues of having data, which when we went to the commission, we had presented a report on a study which was done. And we got feedback in terms of data is important. So we've been at the African Commission as well. And we want to continue those engagements, even as we, as different intersex-led organizations, are pushing with our countries. Because, even when we go to the commission, what do we really want to see from there is that the commission also has other interventions which can also be able to push our countries to be able to recognize and respect the human rights of intersex persons. So that is just a brief of what AIM has been able to do, and there's still a lot in the pipeline.
Thank you so much, Mpatso, and thank you for that great update around the African intersex movement. And I do really hope that that answers the question. We have a question from Patricia, and I would like to go to Ronnie. Ronnie, Patricia is asking, how can the government be made accountable to intersex people? Are you there, Ronnie? Okay.
Yes, I'm here. Yes, I'm here. Thank you. I think first of all, it is important once again to make sure that we push our governments to have laws that legally recognizes intersex people, because I think in most African countries, we find that there is no legal recognition of intersex people. So I think that's the first step. And it should also come in with provisions of the protection of human rights, especially when it comes to intersex people, because we cannot just be vague and talk about protection of human rights, because it's very vague. It doesn't specifically speak of intersex people if they are not being specific when it comes to intersex people as a group that is actually there, that exists, that is recognized by the law. So in so doing, I think it will then have other provisions that then talks about issues of redress, where there are maybe violations of human rights and other steps to be taken to make sure that the rights of intersex people are not infringed upon. Thank you.
Thank you so much, Ronnie. And also just what I would like to add from a South African perspective, what we are doing as an organization at Iranti, when we're asking how can the government be made accountable, take them to court. Like, take them to court, right? We need laws in place to protect intersex people. We need to make sure that there's a ban on intersex genital mutilation. And what we are doing in South Africa is we are pursuing litigation. We want to take the government to court and tell them what you are doing is unethical and these practices needs to stop, right? We are humans and we have human rights and they are being violated. Therefore, we can, take these bodies to court and make sure that they listen to us, because clearly they are not listening. We started this conversation with the question, is healthcare a safe space for intersex people? The answer is no. From all my panelists, the answer is no. Healthcare is not a safe space for intersex people. Healthcare is a space where intersex people are violated. Healthcare is a space where intersex people are mutilated. Healthcare is a space where intersex infants are going through medical torture to fit the binary notions that society wants us to live in. And my ask to everybody that's on this call and that's listened to this conversation, you might know an intersex person. They might not even know that they are intersex. You might know someone that's gone through unconsensual surgeries, right? Intersex people are being forced into boxes. Their bodies are being altered without receiving information about their intersex existence. Intersex people are being erased from society. They are being isolated from society. It's really important that we come together and continue having these conversations about this unsafe place for intersex people. When we look at doctors, we see them as people that are supposed to help us. When we are feeling sick, when we are ill, we look to them as professionals that will help us on our journey in life to make things better. But as intersex people, when we look at doctors, we see scientists and we see ourselves as science projects. We see ourselves as people that received inhumane treatment that was not being treated, but someone that they wanted to fix and someone that they wanted to alter to fit their standards. Before I'm going to ask my panel for closing comments, I would like everybody on this call to please go through the work that my panelists are doing. So firstly, Obioma is the Executive Director of Intersex Nigeria. Please follow them on their social media so you can get in touch with the work they are doing. James Karanja is the Executive Director of Intersex Persons Society of Kenya. They are on all the social medias. Please give them a follow. Mpatso Sakala is the Director of Intersex Society of Zambia. Please give them a follow and see the great work they are doing. And then we have Ronnie Zuze, who is the Executive Director of the Intersex Community of Zimbabwe. please go follow them on all their socials and support them in the work that they are doing. Also, Iranti, for hosting this conversation tonight, really to inform people about this unsafe space of medical health care. I want you to encourage to follow Iranti on their social media and follow the work that we are doing on intersex rights in the region, and also the process that we are following with litigation of taking the government to court and keeping them accountable for the harm that they are doing to intersex people. So we're going to move over to just closing remarks. I'm going to move to my panelists, and I'm going to start with James.
Thank you so much, Crystal. And for me, first and foremost, I appreciate that you managed to bring us together, because it's, very rare for us. I think originally this is one of the realest webinar that we have had. The other thing is that I would want to tell my intersex community activists and everybody, we need to interrogate the power dynamics that comes with intersex issues and what it means to be intersex individual within the existing healthcare systems that have been created. Also, we need to provide adequate information to our community members, because some of the issues that are happening within the violations towards the intersex community coming from the medical community, when you interrogate, you get its lack of information. So it's for us to be a part and act as in between and provide appropriate information to our community. So by the time they are getting into those spaces, they know exactly what they need, they want, and by that time they can dictate exactly how they need to be treated from a human right perspective. So I am once again very grateful for Iranti for giving us this opportunity, and therefore thank you once again for the intersex community.
Thank you so much, James. And I'm so happy that you pointed out, like this is really the first webinar that we have come together as a region in Africa. And like, I'm really proud of us and the work that we are doing, and we're going to continue doing great work together. Obioma.
Thank you, Crystal. And I want to thank my fellow colleagues and panelists and the participants for coming to this wonderful conversation, and Iranti for making the platform available. And I look forward to more engagements like this and expanding on different topics and issues, because the more we talk about these issues, the more we see different ways that we can approach it, and also talk as a family on how to best collaborate together, and it makes us more united. I want to say that healthcare is one of our biggest challenges, but it's not the only challenge intersex people face. Intersex people face a lot of discrimination, stigma, and human rights violations in different parts of the world. And it's very, very difficult for intersex people to coexist, because this makes them to be excluded from a lot of social, economic, and different rights as a human being that we are. So it's important that the government, especially the society, begins to understand the importance of recognizing intersex people, not just recognizing, not just
It seems like Mpatso is also experiencing some load shedding. So hopefully we can get them back before we close. I'm sorry, Obioma. Mpatso, can we move over to you for closing statement?
Thank you so much, Crystal, and thanks so much to Iranti for being able to bring us together, and a big thank you to the participants as well as my fellow panelists. It's rare that we have opportunities like this, and when we have such, we really greatly appreciate. So my last, or I would say not my last, as if I'm leaving the world, sorry. So I'm saying my concluding or closing comments or remarks would be first thing first is I'll start by saying it's very important that people include us in their conversations. It will really change a lot of intersex lives out there. When we look at the different dynamics under which intersex persons exist, there is so much, it's anchored so much around cultural, traditional, and religious beliefs. And we know that in most countries, some countries are Christian, some countries, there's so much, strong influence from the church. So while I say that we should include us in your conversations, it's very important. That is when now you start understanding that intersex people exist. And also you take that interest to also be able to understand who an intersex person is. What are some of the challenges they are facing? But overall, above that, we should also recognize that before anything else, intersex persons are also human beings who need to be protected and who also have human rights just like anybody else. They also part of citizens of the different and various countries we come from. If we start looking from that perspective, we'll see that there will also be a shift on how we look at intersex issues. Quite all right, health is where intersex issues start, and it's also important that we can also be able to address those issues. Recognition is a very important issue, and also we can see that intersex persons are not recognized. And that is where we see that we are being forced to fit into the different binaries. I would love to see a time when I can see intersex persons to be able to live the way they are as intersex people. In short, I would love to see a day where I'll see another sex category being created for intersex persons who don't want to conform to the binaries of male and female, which the medical fraternity has tried so much to box us in, as well as society. So I would say thank you so much to everyone. And yeah, thanks.
Thank you so much, Mphatso. Thank you so much. And like we said, boxes are for things and not for people. And sex is on a spectrum and not binary at all. Thank you so much. Obioma, you were still busy. I see you are back. Would you love to continue with your closing statement?
Yeah, I lost my internet at that moment. So I just want to basically say that a lot of these human rights violations stop intersex people from fulfilling and living their truth as a human being. And it's very important that we keep having these conversations, we keep collaborating as a family, because we have to look out for each other before other people can actually look out for us. So I'm very happy that this conversation is happening, and I hope it continues to happen. Thank you so much for bringing me to this panel, and I'm very happy that my colleagues were able to make it. Thank you so much.
Thank you so much, Obioma. I'm going to hand over to Rani for closing statement.
Thank you very much to our lovely, lovely host, Crystal. I'm very happy to be part of this panel, and thank you very much with your wonderful teammate Iranti, and big thank yous to Iranti as an organization. I think I know Iranti has been doing a lot for the intersex movement from the time that we joined activism. I think Iranti has been doing wonderful work for the intersex movement. So yeah, my gratitude to all of you and to the wonderful panelists. Thank you very, very much. I've learned a lot of things from my fellow intersex folks. I look up to many of you, and I'm still looking forward to learn a lot. One thing that I would like to say, though, is that to our participants, thank you very much for taking time. I know it has been a very long webinar, and sometimes with some hiccups of network and power and all that. But thank you for sticking around, because I can see the numbers, they are still there. And yeah, which is wonderful. It's good to know that at least people are willing to learn, people are listening, people are concerned, they want to know what are the issues, people want to maybe reach out to our organizations, which is very, very important to us. And I would also want to just make one statement that to people who are learning about intersex people and their issues, it is very important to also know that as much as many intersex people might also belong to the greater LGBTI movement, but not every intersex person wants to, or maybe belongs or identifies as LGBTI. Yes, of course, there is power in numbers and power in coming together and forming a unified voice. But I think it's also important to note that we need to respect one another, because if you have met one intersex person, you have met one intersex person. And an intersex story can be different from another intersex story. So it is very much important to note that. And it is also very important to know that under the intersex umbrella, there are more than 46 intersex variations. So we cannot just put everybody under one variation. So it is just important that we try to find out as much information as we can when you are speaking to one intersex person, because it is very important. But otherwise, besides that, you guys have been awesome. And I thank you. I feel so blessed to be part of this wonderful community. And I am very much looking forward to more engagements such as these ones. And thank you, thank you, thank you, and thank you very much.
Yeah. Thank you so much, Rani. And like lastly, I just want to thank all my panelists, Obioma, Mpatso, Rani, and James. I really want to thank you for your time and your expertise, and for being so open to share with all our participants tonight or morning or whatever time it is where you are from. And to all our participants, I really want to say thank you so much for the engagement. Thank you for all the questions. Thank you for all the beautiful feedback that you've left as well in the comment section. What we are going to do as well regarding details of our panelists and the work that they do, we do have the registration list for this webinar, and we can also share details after this conversation with our participants. I really want to thank you for your time and just for your presence. And just in my closing statement, I think it's so important that we just allow intersex people to exist, right? Intersex people doesn't want to be bothered. So please do not bother us. Like, leave intersex bodies alone and let them be who they are. And like Ronnie said, there are more than 47 variations of being intersex, which means no intersex persons are the same, right? We are all different, but it's just like humans as well. All of us different from each other. But the one thing that we need to remember that's extremely essential is that intersex rights are human rights, and we need to all work together to ensure that we end this human right violations that intersex people are facing. I would like to once again thank you everyone for joining us this evening or morning. And also please don't forget to follow Iranti, that's IRANTI, on Instagram, on Twitter, on Facebook, on LinkedIn. Like, we will be doing a lot more work regarding intersex rights, and this will be part of a series that we will follow up on. And if you want to stay in touch with the work that we are doing, please do follow us on our social medias, and also all my beautiful panelists that I had. And I think something that we have to mention is that not only did we have Southern Africa on this call, we had East Africa, we had West Africa. Africa is coming together for intersex people, and we will ensure that we continue to fight for the rights for intersex people. Thank you, everyone. Enjoy. Goodbye. Bye.
Goodbye. Goodbye, everyone.
Bye. Bye. Thank you for coming.
Bye.